Let's talk about the Lloyd technique, a revolutionary approach to colonoscopy. Colonoscopy is a difficult test. It involves taking a flexible fiber optic instrument and going through twists and turns inside the colon. There are a number of different approaches to how doctors learn how to do colonoscopy, but we have found that with the Lloyd technique, using a team approach, we can provide a much more comfortable and thorough examination that is also safer, has less complications. The Lloyd technique involves using first an anesthetist. You have a trained anesthesia provider whose job it is to maintain sedation, keep the patient comfortable, and be sure that their oxygen levels are maintained and their blood pressure is proper. The second member of the team is the GI technician, who's trained to be able to advance and manipulate and turn the scope so that we can take many of the turns in the colon out as we advance the scope. It allows the doctor to focus on the tip deflection and using the knobs, and the nurse or GI technician who's helping advance the scope helps to minimize the amount of twisting and turning that's necessary to get all the way to the end. Another individual in the room is doing the documentation and helping with biopsies. We find polyps in over 2/3 of patients, and so we have a full-time person there to help be sure that we get access to the polyps, remove them completely, and document them. And fourth, of course, is the doctor. The doctor that's controlling the tip deflection, looking at the walls with every other member of the team in the Lloyd technique, being sure that we find every polyp, remove it, destroy it, so that you won't get colon cancer. In 25,000 cases, we've never had a patient go on to develop advanced colon cancer because the Lloyd technique works.